Good morning and welcome back to my channel. So we are starting lecture number 60, bio section. Title is Hemophilia. So the literal meaning of hemophilia is love of blood, but the actual pathological condition is loss of blood. The reason is there is a deficiency of factor 8 or factor 9 in this disease, and this is due to gene loss or gene mutation, and this particular gene is located on X chromosome. This is the reason hemophilia is X-linked recessive disorder. So this is what we are going to learn in this video. First, the list of Mendelian disorders, and then few cases, and finally I will talk about the cause of hemophilia, what actually happens. So Mendelian disorders are mainly determined by alteration or mutation in the single gene. Okay, single gene mutations are Mendelian disorders. And these are few names. I have listed it in this table. So far we have completed these two. Today we will discuss hemophilia, and in the next 2 days I will cover these two topics. Cystic fibrosis is also a Mendelian disorder, but the details are not asked in NTA syllabus. So I will not make any video on this. We will only focus on these five. Okay, by heart these names, because in the question you might get a list of many diseases and they will ask you to identify which ones are Mendelian disorder. Now we will look into different cases. So as I said, it is sex-linked recessive disease, okay, because the gene is found on the X chromosome. The location is on X chromosome. So in this disease, a single protein, either factor 8 or factor 9, which is a clotting factor, that is part of cascade of protein involved in clotting of blood, is affected. So cascade of protein means, the literal meaning of cascade is waterfall. So you have many different proteins, total 12 different clotting factors, and they get activated sequentially. So one factor gets activated and in turn it will activate another factor. So a cascade of protein, back to back, a chain reaction will happen, and these clotting factors will get activated, finally lead to formation of fibrin threads, which will form a meshwork, a net-like thing, and it will form the final clot. So since the protein is deficient, clotting will be affected. So the person will bleed. So there will be non-stop bleeding, even if there is a simple cut. So transmission from unaffected carrier female to some of the male progeny has been widely studied. So I will explain you the genotypes and how those crosses are made. Then another possibility is female becoming a hemophilic. This is extremely rare because mother of such female has to be at least carrier and father should be hemophilic. And this is rare because most of the male who are hemophilic, they are unviable in the later stages of life. So we will understand all these terms. What is the meaning of carrier and hemophilic? Okay. And then we will look into the family pedigree of Queen Victoria. So she was a carrier, and because of that, there were number of hemophilic descendants in the family. So first you have to familiarize yourself with these genotypes. So in the context of hemophilia, what is the meaning of carrier female? Carrier female will have this affected allele, okay, found on one X chromosome. The other X chromosome is healthy. So it compensates for the function, and this is the reason no error in clotting is seen and the female is healthy. So carrier females of hemophilia gene, they are healthy. Non-carriers are just any other healthy female. Okay, they will have normal X chromosome. The gene is not affected at all. And hemophilic females are homozygous for the affected allele. Then in case of hemophilic male, just one single defective allele is enough to make the male affected with this disease, and healthy will have normal X chromosome. So first we will look into this case when the father is healthy and mother is carrier. So healthy father is denoted this way, XY, and carrier mother is shown this way. One of the X chromosome will be affected, other one is healthy, and therefore the female is healthy. Then in this Punnett square, in the top you show the genotype of father. So these are the gametes X and Y. And in this column, left column, show the gametes of mother. So XC and X. So when they combine, you will get a carrier female, and a hemophilic male is also possible. This will be non-carrier female. A simple way you can call it healthy female and healthy male. There are no affected female in this case, only one affected male, and this male is healthy. Then look into the rare case when father is affected and mother is carrier. So affected father, you will have to show this genotype, and carrier mother again XC and X. So write the gametes, male gametes on top and female gametes in the left column. This will be hemophilic female. So this is what was mentioned in NCERT section also. In order for the female to be hemophilic, she need to have a carrier mother and an affected father. So then only the female will be hemophilic. And again, hemophilic male. This will be carrier female, one healthy X chromosome, and this will be healthy male. And now the family pedigree of Queen Victoria. I got this image from this textbook, Pierce Genetics, 4th edition. So this is the family pedigree of Queen Victoria. So here in the second generation, you can see Queen Victoria over here. So you might ask, her mother is not carrier, father is not affected. How come she had this gene? So the possible explanation is she might have had a mutation in the gene. This is the carrier daughter and this is affected son. This is again carrier daughter. So daughters are carrier. You won't see any affected daughter here, but there are many affected male descendants in the family. So important point with respect to hemophilia which you need to remember is a carrier female can pass on the affected gene to her son in X-linked recessive disorders. Now we will quickly understand the cause of hemophilia. So prolonged bleeding in hemophilia is because of delayed clotting. So blood flows in blood vessels. So integrity of these blood vessels is very important. In case of injury, when the blood vessel ruptures, okay, then platelet and clotting factors, they come into action and they seal the injured area in the blood vessel. And this is how the bleeding stops. So see, this is the site of injury. And the first step will be platelet plug formation. This is just, imagine you are putting bricks on top of each other, stack of bricks. Okay, so you need to again cement them all together, and for cementing, clotting factors are needed. So this is the loose platelet plug, like stack of bricks. This image I have picked from Robbins Pathology, 10th edition. So the protein strands are formed, fibrin strands are formed, and a mesh is created, a net-like structure is created, which will hold everything together and it will help to seal the injured blood vessel. So clotting factors form a mesh of protein strands that help to stabilize the platelet plug. So these two important clotting factors, 8 and 9, they are present on this segment, the Q segment of X chromosome. So if this particular portion is deleted or is mutated, the gene will be affected and the levels of clotting factor in body will be affected. So hemophilic patients should try to prevent injuries and stay away from sharp objects, avoid contact sports or other high risk activities. In case of bleeding, use pressure in that injured area, ice, and elevation. And for treatment, organ transplant like liver transplant helps, and also infusion of clotting factor. But see, any foreign protein triggers an immune response. So antibodies develop in hemophilic patients against transplanted organ and infused clotting factors. So this is the reason prevention of injuries is the best. So it's a difficult life, okay? But then if someone is born with this defect, they can live a normal life provided they take care and try to prevent injuries. Now, based on this topic, we have few questions. A woman who has X-linked condition on one of her X chromosome, this chromosome can be inherited by, so it can be inherited, X chromosome can be inherited by both sons and daughter. So see, if the man is affected, okay, he will transmit this X chromosome only to daughters, only daughters. But a woman with affected X chromosome can transmit it to her son as well as to daughter. Okay, both are possible. So this is the reason, this is the answer. Next question. Which of the following most appropriately describes hemophilia? So the right answer is option 2. Then this I have discussed before also. See, just focus on this. Hemophilia. This is incorrect match because hemophilia is X-linked. It is not Y-linked. Pick out the correct statements. So we have covered all these diseases, so we can attempt this question. Hemophilia is sex-linked recessive disease. Correct. This is correct statement. Check for A. A is in 1, 3, 4. Then Down syndrome is due to aneuploidy. Yes, it is trisomy 21. This is correct. A and B. So this won't be the answer. And B is correct. So this won't be the answer. So we have the answer A, B, C. There is no A here. So this also cannot be the correct answer. The only option which is correct is option 4. A, B, C. Phenylketonuria is an autosomal recessive gene disorder. Correct. Why is this statement incorrect? Sickle cell anemia is X-linked recessive gene disorder. It is not X-linked, it is autosomal recessive gene disorder. So the defect is in beta globin chain and beta globins are found on chromosome 11. Therefore, it is autosomal recessive gene disorder. This is the only statement which is incorrect. So with this, we have completed this section also. Tomorrow we will discuss color blindness. Thanks a lot for watching my video and take good care of yourself.